Okay, so, yeah, this is, it really should be smaller,
It'll help.
darker, and drier. It's not, and I don't think we're gonna end up using these. I'm hopeful that when Anthony brings his cats today from TCNJ, they're gonna be better than this. So we're gonna start, this is the old book. So we're gonna start on the old one, 711. It might be earlier. 700. All right. So again, I know these things by heart. No, it's not 711, it's 708. You're in 700? It's the ventral, upper ventral muscles. And I think there, actually, this is a lab book I used in comparative vertebrate anatomy. And I don't know the drawings, even though they're black and white, there's only like 2-3 drawings. I really like the drawings in here. I think I'll send them to you guys.
Cool.
Even the blood vessels in here are very good.
Where do the cats come from?
Where do they come from? I don't know. You mean what state? Oh, well, that's what they'll tell you, but I don't believe these are. How many stray cats can you possibly have? There are 2,000 universities, and they use like 20, 30 cats a year. You know, so what is that? 300,000 cats? They're all strays? I doubt it. I'm sure. I mean, I have never asked, but I would bet you that some of these they breed them. I can't even find them. Well, it's in here somewhere. Cat. I'm getting closer. Closer. Forget it. All right, I'll send you this. It's 2 or 3 drawings, but they're black and white, but they're very good. So again, what I was telling everybody else is that I memorize the order in which these things occur. So I think it really helps if you know the order. Then you know what you're looking for. So in this case, we're looking for the pectoantebrachialis, pectoralis major, pectoralis minor, ziphihumerales. So I hate to say this, but you really can't see the pectoralis major. If you look at the book, you can see how it's a skinny muscle running across the chest that runs into the forearm. See that on top? You really can't see it. I thought maybe I can do, this is it here, this may be it here. I made this little incision here, but you really can't see. It looks like it's this, but you really can't see it on this cat. But you can see, now that it's starting to dry out, can you see the line here? And there's actually a line here. These are muscle, the margins of the muscle. So I know that this is the pectoralis major, pectoralis minor, and this strip here is a margin, this strip here is the ziphihumerales. Now it may not look like it, but it is it. Sometimes you can even see the muscle margins on this side. You can see the clear connective tissue. But we really need a better cat. This is not really good.
Where's the one between the major and the minor? You mean? The line?
No, I would think,
Like there.
yeah, but you know something? It could be here too, but this is too big. The major is smaller than the minor.
Okay.
Let's see what they depict here. Yeah, the major to them is relatively small. And it's usually strips. What I've done in the past when I do the dissection, I cut where the margins are, so you have strips so you can see each one individually. But it's hard to see on this cat. That's why I'm hopeful that he's going to bring up some better cats. We've had better cats in the past, and I'm assuming it was TCNJ cats. You know, thank God for Anthony's mistake. You know. So those are 4 muscles there. If you pull this back, and you can see it here, it's not the great example, but you can see the serrated muscles here. So this whole thing here is the serratus ventralis. And you can see it's very nice in the lab book. Yes? I don't know, you can't see it. It's page 712, so it's like 708 or something like that on yours. see here the serratus ventralis and the scalenes, which there are three, but I usually only pin one, is this long one. And you can see that right here. This long one here is the scalenes.
Oh, it's on 702.
702. There you go. So serratus ventralis and scalenes. The other two are small and they're up here, and I just forget it. I usually pin this. It's easier to recognize. Okay, so that's that. Then superficially, this whole area is the external oblique. It's very, very thin. You can even see the muscle fibers, right? You can see the direction. You see that? Muscle fibers are going in that direction. If you peel this back, this is your internal oblique, and you can see the muscle fibers are now going in the other direction. Here. And then if you peel that back, underneath is going to be the transversus abdominis, which very hard to see. I don't want to rip it or anything. But so you have three layers: external oblique, internal oblique, and transversus abdominis. And you'll see on a good cat we'll do the same thing. We'll peel back the external, and then we'll make a little window to show you the transversus abdominis below. And if I broke this through, you'd start seeing his organs. Okay, so those are three muscles there. So here's getting more complicated. So if you turn to 719, which might be 708 or something. Next, keep going. Yeah, these two. Everyone's there. So on the top, you can see there are just two big muscles, the sartorius and the gracilis. And you can see that there also here. The sartorius, the gracilis. So they've, on the bottom photograph, they've cut the both muscles. Here, Anthony just peeled them back. All right, so here's where I memorize semitendinosus, semimembranosus, adductor femoris, adductor longus, pectineus. That's the order in which they occur. So here's your semitendinosus, a strip thing down here, which you can see from both views, both ventral or dorsal views. But it's usually the skinny little thing here. I'm not sure. That would be the skinny little thing that's hiding on here, right? So this is semitendinosus.
Sorry, I have a doctor's appointment.
Oh, okay. Okay. So this is semitendinosus, semimembranosus, adductor femoris. Then he cut this by accident. He ripped this a bit. This is the adductor longus. And then that little skinny one inside is the pectineus, that little skinny thing in there. I'm not sure. Can you see that? Yeah, you see it's a little tiny skinny thing peeking out. So you should memorize semitendinosus, semimembranosus, adductor femoris, adductor longus, pectineus. All right. And you can see on his leg, this is the muscles on the back of his leg. So these are the hamstrings. Now we're going to go to the front of his leg, right? This is his quadriceps. So when we're peeling back the sartorius, which is possible to see from both views. I've actually, with looking at the dorsal side, I've pinned this here, which is the sartorius, and asked that. And students, the minute you change the orientation, they get lost. So here are your quads. Actually, there's only three muscles. This is the medial side. So this is the vastus medialis. And then on the other side, here's the vastus lateralis. And then right in between, the big guy here, is the rectus femoris. They show it? Yeah, they show it. What you can't see here, which you can't see clearly there, is I think Anthony just ripped it by accident. Right here, there's about an inch-long muscle called the tensor fasciae latae, which inserts into this connective tissue here, but you really can't see it. But you can see it there. It looks exactly like that. It's a about an inch long here, and then you can see, if you leave the connective tissue, you can see the white aponeurosis that it inserts into. You got it?
Yeah.
So, vastus medialis, vastus lateralis, rectus femoris, and tensa fasciolata. So this is all the ventral side. So if we go to dorsal, okay, so there are 3 trapezius and there are 3 deltoids. And again, you know, what can I say? It's not a great example of any of them. You can't even see the spinal deltoid. It's on here to the back. That's the deep muscles. And here, here are the superficial muscles on the dorsal side. So I know I'm looking for a triangular muscle that's below the scapula and attached to the vertebral column. You can't see it. I don't think he even attempted to try to uncover it. You'd have to take all the fat and connective tissue off. But it's usually in the shape of a triangle. So hopefully the next cats we get, you'll see clearly. So it's usually right here on both sides.
What, the trapezius?
Spinal trapezius, yeah.
Okay.
Then the thin layer of muscle on top of the scapular is the acromiotrapezius. And then, hard to see again, but the muscle that runs into the neck is the clavotrapezius. So you have your spinal trapezius, acromiotrapezius, clavotrapezius. The deltoids, again, not very good. I'm thinking possibly this is the spinal deltoid here. It looks very similar. It's right close. You can see it here, right here. So this is in the right position. It's the right shape, so I got to assume that's it. He hasn't really, well, this looks like the clavotrapezius on top, but it's hard, it's going to be hard to see. It's two, you look at the picture, it's 2 strips right at the top of, almost on the posterior side of the shoulder, right? One strip is your acromiodeltoid, and then on top is the clavodeltoid. So you have 3 trapezius, 3 deltoid muscles. This whole big muscle back here, and you can see the darker shade here, this is your latissimus dorsi. If we go deep here, so on the top of the scapula, right, if you can feel where the scapular spine is, you can locate the supraspinatus and the infraspinatus. But those are deep to the acromiotrapezius. And then if you take his arms and go like this, you can expose his rhomboideus muscles, which are like our rhomboid minor and major. Here are his rhomboideus. They're sort of a fan-like muscles. You can see them. Skinny fan there. He didn't really take any connective tissue here, but you can see that it's these little skinny layers here. The one at each end, on each side here, this one, which is a little thicker than the others, actually attaches to the head. So this is the rhomboid capitis. Rhomboideus and rhomboid capitis. And this is your, right, the inferior part of the scapula, right? This is the subscapularis. You know, I'm looking at the other side, and here is, lo and behold, the spinal deltoid is right there. Looks better than the other one. Right? You can see the shape. Right? I think as it gets drier, you'll see more, but it's still a lousy cat. I wouldn't use it. I've never used it on an exam. What else? Last thing. So we're going down towards the rump, and you should be able to see that. Look how nice his rhomboideus muscles are. And here, the thick band here is your rhomboid capitis. So we're looking for hamstrings. can't see anything anymore. So it's here, it should be right here. So again, I've memorized the gluteus maximus is smaller than the gluteus medius. So the first one is the gluteus medius, gluteus maximus, cordofemoralis, bicep femoris. Medius, maximus, cordofemoralis, bicep femoris. All right. And the last two you should know. I'm not going to ask you about the arms and the legs, but you should know there are two muscles here. Here, this big muscle here is the calf. This is your gastrocnemius. And then right below it, as I've talked about it, right below is the soleus. Right below it here. Here's your Achilles tendon. Here's the calcaneal and the calcaneal bone. And here's the tendon of the gastrocnemius inserting into the bone. So this is your Achilles heel. That's it. So there was another gal, she counted, so she said there was 35 muscles. So I'll list them and send them to you. So you're absolutely sure of what I'm going to ask.